Almost 500,000 people in Massachusetts have to reapply for health coverage. The enrollment's underway for people who get their coverage from Mass Health or the insurance exchange, the Health Connector. To discuss the process and how it's going is our guest from the advocacy group Healthcare for All, the executive director, Amy Whitcomb Slemmer. Thank you very much for being with us, Amy.
It's my pleasure.
First of all, I guess this is quite a change from last year.
It is. This is a significantly different experience for people who need to re-enroll in coverage. The Connector's website is working well. We are deploying people all across the Commonwealth, and there are some very simple steps that people can take to figure out whether they need to reapply for coverage and then to make their application successfully.
Well, to start with, who needs to at least reapply, if not necessarily make a change?
Anybody who is currently has temporary coverage. So that's almost 400,000 people in Massachusetts who were put into a temporary coverage program last year. Those folks need to look at their coverage, go online or talk to somebody who can help them, a navigator or an enrollment assister, to figure out what programs they qualify for, and then they actually have to apply for new coverage.
Now, of course, the other thing that's going on here is that aside from just doing what they have to do, there are some things that are optional, but if you look at them more closely, they might actually be profitable.
That's exactly right. So there are a number of people who don't need to do anything right now, but who in fact may benefit from shopping and seeing what coverage options are available for them. They might be able to save some money. We encourage people to go on the Connector's website to see what they qualify for.
Now, I imagine if you're shopping for health insurance, in lots of forms of shopping are drudgery, but this is the drudgery of fine print and terminology. I mean, can people really make distinctions about what they need and what value they're getting?
Absolutely. And one of the improvements that has been made this year is a real shopping experience so that people can compare which plans they qualify for. And there are folks like people at Healthcare for All who can talk to people about what their health needs are and what plans would be best suited for them. So there are lots of options to get help and to get information to figure out which plan is best for people.
Because one of the things I also have to come back to here is that the reason we had the complications last year to begin with is that there was some kind of readjustment needed for the Affordable Care Act. Now, overall, does this really make much difference in terms of what's out there for people and how good it is?
Boy, that's a great question. So in fact, in Massachusetts, we were the template for the Affordable Care Act, but when we implemented here in Massachusetts, there are actually some wonderful benefits that come to the people of Massachusetts, including the fact that people who earn between 300 and 400% of the federal poverty level now with the ACA qualify for subsidies. We didn't have that level of support before the ACA, and now we do. We know that will affect about 34,000 people in Massachusetts.
Because one of the other things we have to still figure out is whether the federal government will completely cover the cost, because there was some added cost involved with the problems last year. So how do you think that's going to turn out?
I'm very optimistic. I do very much appreciate that our federal legislators and the members of the Massachusetts delegation have made our case successfully to the federal government to prove that, in fact, we should qualify for the level of assistance that we're currently getting. And the ability for advocates and for healthcare assisters across Massachusetts to be able to go out into the communities, find people who need to re-enroll, and then help them directly is very important for us to be able to continue our successful coverage rate in the Commonwealth.
Where do you expect the most obstacles in getting the word out to people?
You know, one of the challenges we have are with communities who don't necessarily have English as their first language. So we are actually engaged with people representing more than 20 languages in Massachusetts. The other thing we're doing differently this year is we have enrollment events. So next Tuesday at the Courtyard Marriott on Tremont Street, we're actually having a very large event where people anytime between 12 and 8 p.m. can come, can check their enrollment status, and actually can reapply for health insurance right there on the spot. We have family activities. It should be a very easy way to get personalized assistance here in Boston.
Of course, with immigrant populations, it's not just language. I guess there might even be just confusion out there. You could have legal status, but if you're not a citizen, people might be wondering, can I take advantage of this?
You're right. And so there are some wonderful advocates who can help people figure out what questions they need to be asking and how best to enroll in the coverage that is appropriate and suitable for them.
Right. What about the other long-range kind of goals here? Because I mean, the goals were to provide more access, but also to contain costs. I mean, how are we doing with that?
You're exactly right. And so we take pride in the fact that we have the highest coverage rate in the country. We also have some of the highest healthcare costs in the country. And I know the people in Massachusetts experience that when they go to use their health insurance. And Healthcare for All is working diligently to try to work on containing healthcare costs so that in fact we get higher quality care, better integrated care for a lower cost. There are a number of legislative proposals that will come to the new legislature after the new year that will specifically focus on containing healthcare costs while making sure that people get access to high quality care that they need.
And I guess one of the things that helps drive down costs is that if more people make changes more often, they do more shopping, I think that sends a message to these insurance companies.
I think that's a very interesting point, and I think we'll see what how the market responds to the shifting coverage plans that people look for. One of the things that we pay attention to and get worried about are folks who are shopping for plans that have high deductibles or high copays. They may seem like a good idea while you're signing up for them, but making sure that they provide the access to the care that you need is an additional challenge that we're going to be paying attention to.
Is that a problem across the board, or are there just some populations or some ages where high deductibles and these other out-of-the-pocket costs are more of a problem?
I don't know how it breaks down demographically. I do know that there are a number of people who see it as a cost savings, and for them it may be. However, for folks who actually need to use their coverage, may have a series of chronic issues or chronic diseases to manage, it becomes very expensive for folks to pay out of pocket.
Or if you have certain diseases in the family as you're getting to the middle of life and you got to get screened,
yes,
then that could be a big expense.
It can, and we're very pleased that part of the Affordable Care Act covers a number of screening tests that will be that are without cost. So they're free based on the fact that it's less expensive to pay for prevention than it is to pay for a long-term chronic care or an acute illness that isn't picked up because of screening.
I know there are penalties for people who don't get coverage, but I imagine there are other people out there who still say, well, you know, I'm young, I'm healthy, why do I need this?
You absolutely have a right not to be insured, not to have health insurance in Massachusetts, but you need to pay a fee for the risk that you're taking and for the potential risk that the rest of us are bearing based on the fact that you are an accident away from having tremendous healthcare costs that we don't want anybody to be swallowed up by.
Well, we should mention, if people want to get more information, some help with getting through this, how can they call Healthcare for All?
Well, I would love to have them either call our helpline, which is 800-272-4232. Our phones are answered in English, Spanish, and Portuguese. They can go find us on our website, which is hcfama.org, hcfa.org, or they can like us on Facebook and stay up to date on all the developments about how to get covered between now and the end of open enrollment in February.
Thank you very much for being with us. Amy Whitcomb Slemmer from Healthcare for All. In a moment, we'll tell you about a holiday market in Dorchester.